Okay, are you ready, Glenn?
Yes, I am.
Okay, great. Good afternoon, everybody. Thank you so much for joining us. My name is Samantha, and for those of you that don't know, I work with FLAACOs. I'm the Director of Member Benefits. We're excited to have the opportunity to present to you Go Here's webinar. We're very excited. Before we get started, I'd like to go over just a few items so you know how to participate in today's event. You should see an attendee interface on your computer desktop in the upper right-hand corner. You can listen in via your computer speakers, or if you would prefer to join over the phone, just select the telephone in the audio pane and dial in information that it will be displayed. You have the opportunity to submit text questions to today's presenter by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address them during the question and answer section at the end of today's presentation. With that, I'm going to go ahead and turn it over to Glenn and let us get started with his wonderful presentation he has for us today.
Well, thank you very much, Samantha. I appreciate it, and thank you all for attending our presentation today. My name is Glenn Hamilton. I am Executive Director at Go Here. Have been with the organization for 3 years. Prior to that, I had a career in medical distribution, working for PSS World Medical and then McKesson Medical Surgical, mainly in marketing and sales. And one of my responsibilities at actually both of those organizations was running a program called the Idea Factory. And what that process was how PSS and then McKesson, they've solicited vendors in the medical community for their new products, items that would be innovative for practices, would either be a better value for patients or physicians, or were innovations that provided a better outcome and result for patients. In those 3 years that I had that responsibility, bulk of the products that came through were things that already existed, might be a minor enhancement. Very often they were almost exactly the same and copycats. But we did occasionally have items that were truly innovative. I remember we had some ergonomic crutches that were much more comfortable for patients. We had some scrubs for nurses that were antimicrobial and liquid resistant, that provided, a much better opportunity to stop the spread of infections. Those were some of the things that were truly innovative and in the market. However, Go Here was one of these vendors that came to us with an innovative solution for primary care. And of all the solutions we looked at, and literally there were hundreds, if not thousands, of solutions in that 3-year period that we looked at, this was by far and away the most impactful solution from both the patient's perspective and the physician's perspective, because it changed the dynamic of how hearing healthcare is treated in medicine, and brought it closer to the patient at a much lower cost, thus increasing access to patients and providing better outcomes. So that's what we're going to be talking about today. A little bit about Go Here. Go Here developed a patented automated process for fitting hearing aids. It was developed by their parent company, our parent company, Synetic, in Switzerland. And Synetic distributes hearing aids in a number of European countries. The Go Here Synetic hearing aids are the #1 selling hearing aid in Switzerland, and are increasing their spread throughout Europe. It was introduced to the United States in 2013 and began being adopted by ACOs last year as they recognized how this solution fits in with what their overall focus is in healthcare. What this is it's the only solution designed specifically for primary care. There are other solutions that can be fit into primary care, but this is one that was designed specifically with that intent in mind, and thus does a much better job and is a much better fit. You know, outside of digging a little cerumen out of patients' ears, hearing healthcare is really lived entirely in the realm of either specialists or non-medical licensed dispensers, with only a small percentage of primary care providers screening for hearing loss. The gradual onset often goes unnoticed for many years. And what this does is it gives the associated comorbidities of age-related hearing loss time to manifest themselves. You know, how prevalent is age-related hearing loss? Well, it is the third most prevalent chronic condition in the elderly, and one of the least effectively treated. Only 14% of patients that need hearing aids end up getting them, and they cite cost as the #1 reason why they don't. With the Go Hear solution, 80% of these patients can be treated by their primary care physician. And so when you're looking at your patient panel within an ACO, you can statistically expect that half your patients suffer from age-related hearing loss. So what's the effect of you know, why is, you know, we know it's prevalent, but why is it important? Well, because it goes highly untreated, patients are affected by associated comorbidities: falling, dementia, hospitalization and depression, social isolation, and these lead to, and there was a study just conducted actually and published last year, 33% higher healthcare costs for patients that suffer from hearing loss versus those that don't. And those are through those associated comorbidities. In general, there are other quality of life issues that not only affect the patient, but they also affect the patient's family. And very often we see that in our practices where family members bring the patients in because they see the effects much more than the patients do. On top of that, for patients that are still in the workforce, there's a negative impact to household income. On average, household income has been found to be up to $12,000 per year less, depending on that degree of hearing loss. I participated, you know, I've actually talked to patients who have exited the workforce. I remember talking to a lady that had age-related hearing loss, and she was in retail, and she had to quit her job because she couldn't communicate with her customers. So what keeps patients from getting treatment? Well, part of it is, you know, cost and complexity, and part of it is the slow onset and patient awareness. Patients often wait 7 to 10 years before seeking help because, you know, much like vision, it comes on, you know, gradually, and so patients can cheat the way to effective hearing for a while, or they may not at all, you know, and they offset their hearing loss by turning the volume on the TV up, or by leaning in, or by asking people to repeat themselves. But eventually, that leads to it gets to the point where those little cheaters either affect those around them or end up not being effective. And then, you know, once the patient realizes it, they are confronted with a process that's prohibitively expensive. The average price of hearing aids sold in the United States in 2015, which is the last data we have, is $4,700 per pair. And what that does is that turns away 3 out of every 4 patients who seek treatment. They either decide that they cannot afford that treatment, or that it does not provide the value that they believe treatment provides. You know, and this is out-of-pocket expense. Insurance almost never covers age-related hearing loss, and nor does Medicare. Medicare does reimburse for testing, but that's as far as they go. And then, you know, should they decide that, you know what, I'm going to spend the money and make this happen, it's a complex process. You know, my personal story that I tell more often than I should is when my dad finally went to get hearing aids, he had severe hearing loss. And the process took him 5 appointments over 6 weeks to get his hearing aids. It cost over $5,000. And asking that of somebody that's over 80 years old to go to a specialist that was a 30-minute drive away is a lot, and it's very often a burden on the family. So why should ACOs incorporate hearing healthcare? And you know, one of the benefits, one, we kind of focus here on the triple aim of healthcare, population health, by treating patients for age-related hearing loss at a higher rate of efficacy. You lower their ongoing patient cost by as much as 60%, based on that study I cited from last year. So from an ACO's perspective, they're reducing their ongoing cost of health care for their patient population as they treat more and more patients. So they build up kind of a bank of patients that are going to be less expensive than they would have been. Additionally, by integrating a solution like this that involves screening patients to identify the hearing loss, they get early adoption. Instead of the patients waiting 7 to 10 years until it is just beyond what they can bear, patients get identified early, get educated as to what the ramifications are of not getting treated, and tend to opt in more often, those patients that were left to their own devices to get help. The first per capita cost of patients is reduced downstream. And then additionally, the patient experience is dramatically improved. Patients with hearing loss have 10% lower probability of having favorable ratings to their patient-physician communication, and 6% lower odds of having a favorable healthcare experience. Additionally, you get huge positive patient feedback from the patients that are treated, and that leads back to these quality metrics. We're regularly provided feedback from our physician offices that are utilizing our solution on stories that they get from patients after being treated. Examples like, I haven't heard a bird in 10 years. Patients that called in on their drive home because they didn't realize that their turn signal actually made a noise until they'd been treated. Those are the kind of very positive experience. Thank you notes, things like that are outside and above the norm when patients get treated for something like this that affects their life so intimately. So how can ACOs incorporate hearing health care? And that's where GoHear comes in. GoHear's got a simple 3-step process of screening patients that can be done. The screening process can be done, at the annual wellness visit or as patients come in. It takes us literally 5 seconds, no longer than a minute, to identify patients with need. Then those patients where need has been established are tested in an automated process that provides automated results, and it can be done in a quiet exam room, so there's no investment of soundproof booths. There's no investment in no significant investment in specialized training for the administration of the test because it's fully automated. And then the treatment is through pre-programmed hearing aids that provide advanced technological help at a much lower cost and fit 80% of patients with hearing loss profiles. They're with their hearing loss profiles. Early last year, American Family Medicine Medical, a practice based in Ocala, conducted a ACO pilot of the Go Here solution so that they could share it with the rest of the practices in their ACO. And how they do it. One, they went through the simple integration of this clinical process, which included the screening, which is done simply at intake, and it was actually integrated with some of their other chronic care management campaigns, so that it was not part of a one-off. It was just integrated into their process of screening for diabetes and things like that. Patients that were identified as having unspecified hearing loss were brought back in for their hearing test. It's patient self-administered, takes 7 to 10 minutes. The MA just has to put the patient's demographic information into the system, give the patient simple instructions on how they would proceed through the test. They start the test, they observe it for a minute or so just to confirm that the patient is progressing through the test. They can leave the room and multitask, and then come back at the end of the test. They have the results, and those results are definitive, but also they had the patient in one of 3 directions. Predominantly, the patients are candidates for the hearing aids, but less predominantly so, the patients are identified as having either severe to profound hearing loss. Those patients have more complex needs and would be referred to an audiologist because the patient can't be brought back from 0 to 100 in one step when they have hearing loss like that. And so it would be multiple appointments with a specialist as appropriate. And then the other group of patients that wouldn't be fitted for hearing aids are patients that have atypical hearing loss. And those patients would be referred to an ENT, and they're identified as part of the test or as part of the pre-test process. Those patients would go to the ENT for additional diagnostics to see what is causing that atypical loss and if it can be addressed by that specialist. But if they are candidates for the hearing aids, it's a quick 5-minute process to fit the hearing aids. The patients get to try them on in the office. And should they want to purchase them, it's a 60 to 70% savings from what they would pay elsewhere. They are educated on how to take care of their hearing aids. They register the warranty, and the physician office generates $670 in net profit on the sale of those hearing aids, and that's on top of the reimbursement that they would get on the administration of the test. So what were the results of implementing that process in the practice? Well, for 8 weeks, they screened patients and identified patients that needed to be tested, and they brought in 21 patients for hearing tests, so that's less than 3 patients per week. were identified and actually came back for their hearing test. Of those 21 patients, 15 were candidates for the Go Hear hearing aids, about 75%. And of those 16, half of them chose the treatment. So 50% of qualified patients purchased the Go Hear hearing aids. That extrapolated on an annual basis by testing 3 patients a week, by screening their patients as they come in for annual wellness visits. They're generating a net profit of $49,000 of new annualized revenue, and they will treat 52 patients annually. Now, that's the patients that they treat within the practice. As I mentioned that 16 of the 21 patients tested were candidates for the Go Hear hearing aids. Well, of those 5 that were not candidates, they were either referred to an audiologist because they had severe to profound hearing loss, or they were referred to an ENT because they had been identified as having some atypical hearing loss and in need of additional diagnostics and potentially treatment that way. So 52 patients are treated within the practice, plus additional patients were sent out to specialist care. So that's not the extent of the story of what their clinical efficacy is. Additional ancillary benefits to the practice were patient satisfaction, as we've talked to, and not surprisingly, employee morale. The employees involved in the program were excited by the visceral difference that they were able to make in the lives of the patients that came into the practice. We've seen staff that have been almost giddy telling us stories about what they've been able, what they've observed for patients after getting treatment that was affordable. And then separately, the doctor mentioned that his communication with his patients has improved downstream. He's noticed that the conversation with his patients has changed. It used to be that he would talk to the patients and they'd nod their head, probably because they just had no idea exactly what the physician was saying, but they just wanted to be agreeable. Now they have conversations. The patients ask questions because they understand what the physician's saying. And when they don't understand what the physician's saying, it's not because they didn't hear it. It's because they literally weren't clear on what the physician was trying to tell them. So the physicians feel that they have a better chance of having better communications with those patients ongoing once they've been fitted for hearing aids. So, as it states there, Go Hear seeing significant adoption by the largest, most successful ACOs because there isn't another solution like this. And it's not just because there's not another solution in hearing healthcare. It's because unlike other chronic conditions that ACOs manage, this is identified and treated in a single visit. It's not like diabetes where it is managed ongoing year after year. The patient's tested, the patient's fitted for hearing aids, the patient walks out different than what they walked in, and it is not something that has to be revisited on a regular basis by the practice. And it has these spillover halo effects that help the practice, help the patient, and so it is. It ends up being, effective and affordable treatment for those patients in need. So no other place does the physician, is it better for the patients to receive primary care than at the primary care physician's office. By actively screening patients, the primary care physician is pre-positioned to catch this early and more often than elsewhere, because, like I said before, left to their own devices, the patient's going to wait 7 to 10 years. And then they may either go to a specialist or they may go to their primary care physician to seek help. It changes a practice, but it changes it for the better. It provides an additional stream of revenue for the practice. It provides a stronger touch point for the patient with the practice. It can bring new patients to the practice. And in short, we're seeing great results with an increasing number of physician offices, and we're increasing the partnerships we have with ACOs, and with that, I will end this and leave it open for questions. So do we have any questions?
If anybody wants to raise their hand and ask questions, you're more than welcome to. I can unmute you. Or if you wanted to type one, you're more than welcome to. I didn't see any typed questions. Did you?
I did not.
Okay. If you don't have any questions, this webinar will be available on our website by Friday. So if you didn't get to catch it all, or if you want to share it with a friend or a coworker, please feel free to go to the website, www.FLAACOs.com, and the link will be there to view this. As you can see, there's also their information here that I will add to the website in case you wanted to get more information from Glenn and Steve.
Yeah, and one of the things that I wanted to point out is the study that was conducted by the ACO in Ocala. I do have the details of that study available. Should anybody want that, I'd be happy to send that to them via email. So please just send that an email to info@gohear.com, and we'll get that right out to you.
Okay, great. Well, we appreciate your time, Glenn and Steve, and Go Here, and I will make sure that this is up by Friday with all this information, and if anybody has any questions, they will reach out to you.
Okay, well, thank you very much, everybody, for being here, and I look forward to hearing any questions that come up.
All right, thanks. Take care.
You too. Thank you.